Hello. Today we're going to talk about our neurostimulator. We'll start with how to program the technology, and next we'll go through the process on how to implement the technology with a patient. So to start with the PT unit, we have the programmer here. It is a computer that will walk you step by step on how to program the battery of the device and where to place the tacks within the nerves on the patient's ear. Secondly, this is the battery that will charge the battery pack, that will charge the battery as well as confirm the voltage so that we will be ready to then implant the device on the patient. An example of the device is just here. So it's very, very small. It's about the size of a domino. It will be placed behind the patient's ear of their choice. Typically, it's placed behind the ear of which they do not sleep on and where they are experiencing the pain. So for example, if they are having lower back pain on the right side, we would place this behind the right ear. There are 4 tacks. There's 1 ground tack, 3 additional tacks that then are placed on the front of the ear. And these, per the programming unit, will be decided from the diagnosis of the patient as to where they're placed on the front of the ear. This tool is the nerve finder. So very small, it's turned on. This is the ground. So this is then placed behind the patient's wrist to which we're placing the device. So going back to the example, if the patient is experiencing lower back pain on the right side, we would connect this ground to the back of the right wrist. Thereafter, we would find the nerve with this applicator. So you would take off this top. And when you connect this to the patient's wrist and the ground is established, you're able to find the nerves with this pen from a loud sound, screeching sound, when you tap the patient's ear based on the nerves outlined from the programmer. I'd like to walk you through the supplies necessary in order for a successful implementation. So here we have scissors and tweezers. Here we have steri strips and another adhesive to ensure the proper placement and stay of the cathodes. We have gloves. This is a marking pen, so we will use that to mark the nerves that the programmer provides based on the diagnosis of the patient. We have mastisol, so this will ensure the stickiness of the device. We have Tegaderm. We also have a second option for that medical glue right here, as well as Q-tips for proper placement, and then alcohol pads.